Good afternoon, viewers. We are back again with our Facebook Live session today, and we have Dr. Saibal Moitra, adjunct professor and senior consultant, allergy and immunology at Apollo Multi-Speciality Hospitals, Kolkata. Good afternoon, sir.
Good afternoon.
Today's topic, as we all know, is allergy and immunology. So before we start, we get into the depth of the discussion. The first question that everyone would like to know is, what is allergy?
Allergy is a terminology which is used by everyone. Everybody you ask, you have allergy, he or she will say yes, I have allergy. But from the medical point of view, the scientific point of view, when we talk of allergy, we actually mean it's the untoward heightened response to any innocuous substance to which another individual would not respond. So that means if one is getting exposed to, say, some pollens or house dust, usually these are innocuous substances and we should not react to these substances. But in certain individuals, they are genetically programmed in such a way that they react to it. Reacting to it means they develop some symptoms when they get exposed to those, which could be some respiratory symptoms or nasal symptoms or skin symptoms, anything. So this is what we call in medical parlance to be allergy.
Right, sir. The next question, how common are allergic disease in India?
Initially it was used to thought that allergy is a disorder of the Western people and it's not very common among Indians. Very early, somewhere around in the late 1970s, early 1970s, as I would say, Dr. D.N. Shivpuri of the Vallabhbhai Patel Chest Institute, he first introduced this terminology in Indian population and he showed that allergy is also a common disease among Indians. Now, if the statistics say that 30% of the Indians suffer from one or the other allergic diseases. So if you take a population to be about 1.3 billion as it stands today, unfortunately, then 30% of that means a huge number of patients or people are suffering from one or the other allergic diseases in our country. That means it is a very common ailment and it causes lots of suffering among the people. But it is still underdiagnosed and it is still people give less importance to it, but it needs to be stressed upon from again and again. It's a common problem, it causes lots of suffering and needs to be properly treated to bring about the changes or improvement in the patient's quality of life.
What are the types of allergic diseases?
When we talk of allergy, allergy is a scientific terminology as I have just stated. But when it translates into a specific disease in an individual, it could be related to many organs. Say it is related to your nose, we call it could be allergic rhinitis or sinusitis, or it could be rhinosinusitis. When we talk of the lungs, the patient may manifest the symptoms of allergic asthma. It could be for the eyes, it could be allergic conjunctivitis. For throat, it could be allergic pharyngitis. And when we talk about the skin, it could be an atopic dermatitis, which is a very common allergic condition of the skin. Then it could be a food allergy, which is related to the GI tract, where the patient consumes some food and manifests some symptoms pertaining maybe to the GI tract, which could be vomiting, diarrhea, abdominal cramps, or it could be like the patient consumes the food and develops a skin symptoms like a skin rash or itching. Then it could be drug allergies, that is, the allergic conditions and symptoms occurring after taking some medicines, which may occur immediately after taking the medicines, or there may be some delay in the causation of the symptoms. And those symptoms could be mild, like some rash, itchy rash, some hives like some swelling, till it could be very severe symptoms, serious life-threatening symptoms, where there is blistering and peeling of the skins and the mucous membrane, which we call a severe cutaneous adverse drug reactions, and it's like the Stevens-Johnson syndrome or toxic epidermal necrolysis, which are emergent skin conditions, allergic skin conditions pertaining to the consumption of some medicines. Apart from that, there could be various other serious allergic conditions, like it could be an anaphylaxis, where the patient's BP suddenly falls, patient collapses because of some allergic triggers, which could be as trivial as house dust mite or pollens, or some food items, or some medicines, or any cosmetics, anything. And there could be angioedema, where there is swelling of the lips, tongues, maybe swelling of the airways. These are all very serious allergic disorders. And by and large, all these symptoms pertaining to various organs, they can occur simultaneously, or there may be a temporal relationship, that is, an individual will develop one symptom at one time, then another symptom at another time, but it goes on over a period of years, and the patient ends up actually visiting various doctors of various specialties from time to time. This is what we call an allergic, getting to see more and more of the allergic diseases. Okay. This is not to the fact that people are getting more aware of the allergic diseases and they are trying to understand their symptoms and visiting the doctors, but there is a real rise in the allergic conditions in our country also. Now, there are various actually reasons to it. Few reasons are like the environmental conditions. Like now, just recently we heard that there is a global warming, and there was this conference in the Glasgow recently, and this global warming, increase in the greenhouse gases in the atmosphere, it causes an increase in the various allergic reactions to various environmental allergens like the pollens, dust mite, and various other fungal spores and all. Apart from that, our changing habits, like the changing food habits, our changing lifestyle, all these cause increase in allergic diseases. Another point is that the increase in the pollution, that is the air pollution, air pollutants, that is the diesel exhaust particles, the ground level ozone, the oxides of the nitrogen, the sulfur, and the traffic related air pollutants, the traps, all these which is increasing in our atmosphere, in our ambient air, it causes a rise in the allergic disorders. Apart from that, we also find that there are various viral infections which is occurring from time and again. It is also causing a change in the reactivity of an individual to the allergens, and this also causes a rise in the allergic diseases. We are to see whether this COVID-19 pandemic, what impact it will have on the allergic diseases in our patients, among us, in the years to come. That's we are yet to see. So these are all various conditions which include the host factors, our lifestyles, our eating habits, it's then our change in the environment, which is causing a rise in allergic diseases. Apart from that, there must be some other unknown factors which we still yet to understand, still yet to know, which is causing the rise in the allergic diseases among the people.
What are the causes for an allergic reaction or an allergic disease?
The causes could be many. Apart from the food and the drugs, which I just talked about, there could be the pollens. So pollens are an important cause of the respiratory allergies. We have the tree pollens, we have the grass pollens, we have the wheat pollens, so the India being a tropical country, and we have the variety of the vegetations, and so which grows, and the trees and the grasses are pollinating throughout the year, so what they have these pollens and load in the environment can trigger an allergic reaction. Then we have the fungal spores, that is the in the carpets, in the mattresses, and the particles of these dust mite particles are highly allergenic. When we inhale them, they can cause respiratory allergies and also the nasal allergies. There are many house dust mite, but most importantly we see that Dermatophagoides stenocinus, Dermatophagoides perini, Blomia tropicalis. These are the few dust mites which grow very abundantly in our homes. Then we have the storage mites. The storage mites grow where there is storage of the grains, storage of the food items, and these are also important cause of the allergies. Then we have the animal danders, that is the danders of the animals, that is the furry animals, especially the cats, dogs, and their danders are highly allergenic. Then we have the other insects like the cockroach allergens, and this cockroach is quite grows in almost all the homes. There hardly any home you will find there is no cockroach in our country. So, and this cockroach allergens are highly allergenic. So these are the various causes of the allergy. Apart from that, I have said that there are multiple food items, and mainly the food items which we talk about, which are allergenic foods, are like the cow milk, the eggs. Then we have there's the prawns, and the sea fish. Then we have the soya or the soya milk, soya bean, and then we have there's the carb as the fishes. So there's peanuts and other tree nuts. So these are some of the food items which are quite highly allergenic, and it does not mean that these food items will cause allergy to all individuals, but these are the important food items which can cause allergy to individuals. And then we have the medicines, any cosmetics, any chemicals by and large can cause allergic reaction in a susceptible individual.
What are the symptoms of this disease?
Symptoms usually pertains to the organ system which has got involved in a particular time. Say a person is having allergic rhinitis, he or she will have the symptoms of sneezing, blocked nose, runny nose. Then there's a headache, there is watering of eyes, redness of the eyes, heaviness is in the head, and these are the symptoms. Rhinitis. Asthma symptoms we have is the cough, then wheezing, then shortness of breath, and the symptoms occur intermittently, increases at night. There are early morning awakenings and things like that. The chest heaviness, these are symptoms of the asthma. For any food allergy pertaining to a GI system, we can have the symptoms like vomiting, diarrhea, then abdominal cramps. So these are the symptoms of the GI involvement in case of the food allergy. Then skin symptoms we can have, there's a skin rash, itchy skin rash, and then we can have the hives, swelling of the lips, swelling of the tongue, swelling of the eyes. These are symptoms of angioedema, and when there's larynx involvement is there, so there could be like shortness of breath, patient might have a choking sensation. Anaphylaxis is a serious disease where the patient can have symptoms of feeling of doom, and they feel very uneasy with the lowering of the BP. They can collapse, they can become unconscious. So these are the symptoms which we usually commonly see in the patients.
So how can we prevent this?
Prevention of an allergy is a very, very interesting domain. And because, as I have said, what are the causes of rise? So if we just are able to curb those causes, some are in our hands and mostly are not in our hands. We cannot do much to our environment except that we can do some advocacy and take part in all the meetings where we actually play some role in improving our environment. But apart from that, like sticking to our traditional food practices, eating habits, that is very, very important. Our traditional homes or the traditional lifestyle which we followed, which our ancestors followed, like staying in an environment where there is close contact with the vegetations, with the soil and with other animals while the child is growing is quite important in curbing the allergies. Then breastfeeding is very important because breastfeeding helps in reducing allergic diseases. Giving colostrum to the child, that is the first milk, is also very important. It reduces the allergic diseases. Very importantly, that is a rise in the cesarean section or C-section, also a cause of increase in the allergy. So in all, means asking all the doctors to just resort to the traditional method of vaginal delivery if there is no medical indication for the C-section, because the vaginal delivery, it actually helps in restoring the child's gut microbiota, actually forming the gut microbiota, and the vaginal microorganisms also helps in reducing the allergic diseases in any children. This is important. Then apart from that, definitely one should not smoke. Smoking increases the allergic reaction and inflammation in the airway, so the allergic diseases can also rise. Symptoms like the rhinitis, sinusitis, and the asthma gets aggravated. So these are all the things which can definitely help us in reducing the incidence of allergic diseases, and especially if both the parents are allergic, then there's a high chance, there is around 60% chance that the children will also have some other allergic diseases. So counseling the parents as early as possible, and to make them some changes as in lifestyle modification in their homes, and also along with that, as I've said, that to resort to vaginal delivery, breastfeeding, and things like that definitely will help to reduce the occurrence of the disease in that susceptible child.
What is the treatment available for this?
Treatment for the allergic diseases is, first of all, if we can actually pinpoint the causes, what is causing the allergy, we can ask the individual to avoid that if it is possible. So allergen avoidance is a cornerstone of the treatment. And so apart from that, so that's why we do an allergy test, but we don't simply end with the allergy test and we tell the individual to avoid all those items. That's not the right way to do it. After getting the test results, we need to sit with the patient and we correlate it with the patient's history and see whether those allergens are actually present in the patient's environment or not, and if present, then only one needs to avoid those. That is an important concept which needs to be reiterated again and again, because it's very important for every one of us to understand. Second thing is that we have the pharmacotherapy or some medicines, like we have the asthma medication, there are inhalers, that are inhaled corticosteroids are the backbone of the treatment of an asthma. So this inhaled corticosteroids along with the other this controller medications which is usually a long-acting beta agonist, also in the form of inhaler, and some of the tablets like the lipidin receptor antagonists which are given. For the rhinitis, we give the intranasal steroids. There are lots of intranasal steroids available in the market. So that is the mainstay treatment of the rhinitis. Then for atopic dermatitis, basically we resort to the emollients, that is the use of the moisturizing the skin, and the relieving of the symptoms by the use of the second generation antihistamines. These are the mainstay treatment. And for the anaphylaxis, basically the most important, the only treatment of the anaphylaxis is the injection of epinephrine. Unfortunately, epinephrine in an auto-injector device is not available in our country, which is the only treatment which needs to be given to an individual, which he or she can take at home when there's an anaphylactic reaction. When one gets anaphylaxed, one has to take epinephrine, but in our country one has to rush to an emergency department of any hospital where they give the epinephrine. So epinephrine is the treatment for the anaphylaxis. Third option what we have is the allergen immunotherapy. Allergen immunotherapy is the only disease-modifying treatment in the allergic diseases, because this is the only modality which can actually modify the body's response to the allergen and can bring about a long-lasting tolerance, so that the individual does not react to that allergen when the allergen enters the body in the future. But this allergen immunotherapy can be done only for very few selected aeroallergens, number one, though nowadays the oral immunotherapy is coming up for the oral allergens, but that is still, it is coming up. But what is actually available for we have the biggest number of evidence is for the inhalant allergens, and these inhalant allergens has to be chosen very rightly by proper testing, then proper correlation with the history. The patient has to be chosen, and then the patient is detailed about the immunotherapy. These are actually a long course, usually lasts for 2 to 3 years, and immunotherapy is given in the form of injections or the sublingual tablets or drops. The individual needs to take that immunotherapy for a constant 2 to 3 years, which actually brings about the immune tolerance, and so that the patient comes out of the medicines, the patient usually do not react to the symptoms, and the patient's allergy has got controlled. So these are the mainly 3 arms for the treatment, that is allergen avoidance, the pharmacotherapy, and the immunotherapy. And by carefully selecting the patients, and this is one of the 3 arms which are given together, or maybe one after the another depending upon the case, so we actually treat the patients in allergy.
Thank you, sir. As we end today's session, I'm sure our audience have learned a lot about allergic diseases and how to prevent them and how to treat them. I'm sure they'll have more questions, and we'll have yet another session with you discussing them. Thanks a lot.
Thank you.